again, good morning and welcome back. It's still Daybreak Africa, reaching you here from my studios in Ondo City, of course. I'm Ezekiel, Ogar. This morning we'll be talking on World Hearing Day 2024 as illustrated within Iron Angela, making air and hearing care a reality for all. And with us in the house is Dr. Akpalaba Immaculata Ogechi, consultant and nose and truth surgeon, and also a senior lecturer in UNIMED here in Ondo. And next to her seated is Professor Dele Owolawi, Professor of Audiology, Head of Department of Audiology, Speech and Language Pathology, also in University of Medical Sciences here in Ondo. Welcome on Daybreak Africa.
Thank you
very much.
Now, just before we go to discuss up today, let me run through quick statistics for the year. Now, this year's theme urges us to rethink our approach to hearing health, given the urgent need for improved access and greater inclusivity. In the World Health Organization Eastern Mediterranean region, 78 million people are currently living with hearing loss. More than 2 million children aged 0 to 15 years in the region are affected by disabling hearing loss and need rehabilitation to mitigate this adverse impact on their lives. By 2050, it is projected that 194 million people in the region will have problems with their hearing. Nearly 80% of people with hearing loss live in low to middle income countries, and most of them lack access to necessary intervention. Now, this has been a program that has been ongoing over years. Now, what's your take generally as to World Hearing Day? Just for going into details.
Yeah, thank you very much for having us. It has become imperative that we celebrate the World Hearing Day. Hitherto, people were not bothered about issues that concerns auditory system, the ear. We can see all over the place that we abuse the auditory system all the time. Policemen slaps indiscriminately, prefects in school, parents, they think that's a way to discipline a child. But we have come to that realization that it is a very bad thing to do because of the injurious nature of abusing the auditory system. Noise pollution all over the place. And of course, without hearing, speech cannot be developed. A child will not develop speech without hearing. And the World Health Organization, in its wisdom, came up with the idea of celebrating on the 3rd of March of every year World Hearing Day. What is the purpose behind that? To sensitize people, to make people aware. And like you rightly said, the statistics is actually increasing year on year. In 2008, Nigeria had 6.8 million people with disabling hearing loss. When I say disabling, we do not even include people with mild hearing loss. These are people from moderate to severe to profound hearing loss. But 10 years thereafter, 2018, the population of people who have disabling hearing loss had increased to 8.5 million. So what are we talking about? It appears people are not concerned about the injury that is sustained by abusing the auditory system. Worldwide, 466 million people by 2018 statistics from World Health Organization. 466 million people suffers from disabling hearing loss. And 2/3 of all those people resides in developing countries like Nigeria, India, mostly in Africa. And we do not have what it takes to be able to address in terms of manpower. We do not have the facilities enough. For example, University of Medical Science Ondo is the first university to establish a program in this field, in audiology, to make sure that we train professionals who will go out there, educate people, treat people, and make their life better. Because hearing is something that is tied to quality of life. If you do not hear, we all know the kind of stigmatization that comes along with it. Oh, sometimes they think, oh, the child is mentally retarded. No, the child is not mentally retarded. Sometimes they just neglect the child because the child could not hear and the child could not speak. And we use the obsolete term, deaf and dumb. No child should be dumb in this country, because in the real sense of it, by 3 months at the most, the child is detected of having a hearing problem. In fact, as soon as the child is born, these days there's technology to be able to do neonatal hearing screening. And once the child is detected, by 3 months, the child should be fitted with hearing aids. And that child will acquire speech like any other normal hearing child. So this is the message we want to propagate and make people become aware that you don't have to keep your child who has a hearing problem at home. You need to bring them out. There are solutions. There are experts that can help. So we are not yet there, but ultimately we will get there.
Well, Prof, to some extent, it made it sound as if Nigeria as a government are doing less in order to actually mitigate issues and challenges as this.
Yes, in the sense that we are just beginning to have a training program. 2 universities now, University of Medical Sciences here in Ondo and Federal University of Health Sciences.
The whole of the country, just 2? Yes,
just 2. In Ila, Osun State, just 2. Where others are showing interest, but we wait to see what is going to happen.
If I may ask, why did it take this long?
Yeah, that's the very fundamental question. Like I said, people are a little bit insensitive when it comes to issue of hearing. We talk about ophthalmology, opticians, and so on. Everybody feels it's fashionable to wear a pair of glasses. So, and another thing is that hearing loss is a hidden disability. People do not see it. So it does not evoke any form of empathy, unlike the visual. When I see a beautiful guy, beautiful lady, handsome guy with visual impairment, it evokes my sympathy immediately. Oh my God, look at this beautiful person, look at this. But we don't see the hearing problem. And because we do not see it, it does not, like I say, evoke any form of empathy. So it has been neglected for so long. In fact, we went on a road walk on Monday. We went around the vicinity of the general hospital, and most people were telling, oh, I can hear, I don't need to go and check my ear. Whereas whether you hear or you don't hear, it is mandatory that you check your ears and hearing at least once a year to make sure that nothing is happening. Because sometimes there's an insidious thing going on. We all expose ourselves to noise all the time. The effect is gradual. It's not instant. It's not, So people have to check their hearing. But like I said, because people are insensitive to this, they think the auditory system is less important, So that's why it has taken us such a very long time. We've tried to reach out to the government, to institutions. Look, other countries, for example, I worked in South Africa, and about 6 universities have a program, a training program. University of KAFTAN, University of Witwatersrand, University of Pretoria, KwaZulu-Natal, they have program training people in this field. Some of them are based in South Africa, some of them are in Australia, in Canada, and so on. But Nigeria is just waking up, not for lack of resources, but lack of will, political will, to be able to do something about it. And that's why we are coming to make sure that these things become well known all over the country. We are starting from Ondo State, and I'm glad to be here. Thank you.
At some point, I would like to talk more about lack of will politically, but just before that, Dr. Ogechi, what's your take as to the level of inclusive setting in situations of education and workplace? Have we as a nation tried to accommodate things like, say, sign language interpretation, provision of assistive technologies and all that? Do you think we've been thriving in that part, away from political will and other political tricks attached to this?
Thank you very much. We actually thank the World Health Organization for this initiative of World Hearing Day. Apart from that, in our institution here in Ondo State, University of Medical Sciences, our Vice Chancellor, in his wisdom, following his exposure, has also established an office called Office of Disability Affairs and Services in the university. This office is to ensure that the university environment is made disability friendly. So it's going to be inclusive, including all forms of disabilities, such that such individuals that have deaf hearing loss, even those that are deaf blind, they can be able to acquire education and reach the level to which they can and they wish to, alongside with other normal individuals. So the university right now is partnering with a university in New York called University of Gallaudet. We just had a meeting with them recently in January. That's the first university that has been taking care of disabilities. So here in our environment in Ondo State, the university is imbibing that culture to make education all-inclusive, taking care of the disabled individuals.
In the wrong run, sorry, but from your conversation, it's more like the university has been doing a lot, but the government, Nigeria as a nation, are doing less and less. You know, that Prof tends to make it seem as if, you know, she tried to be a little mad in the conversation, but it's obvious she actually was processing on the same point. More like the nation is doing nothing concerning issues and challenges as this.
I wouldn't say that the nation is doing little, but it's still not enough. Yeah. I know in the background, most universities, most teaching hospitals, even private hospitals, NGOs, they're all doing something to ensure that people get aware of hearing and how to take care of both their ear and hearing, what we call ear and hearing hygiene. But we still believe much can be done.
Anyways, before I give the table to Ezekiel to talk about the political will of the government, I'll first of all like you to analyze to us how sensitive is the ear, and what are some of those factors that contribute to it over time, probably getting to damage?
Okay, thank you very much. From our elementary science, we know that the ear has three parts: the outer ear, the middle ear, and the inner ear. And the primary function of the ear is not just hearing, it's both for hearing and for maintaining balance. So once there is a problem in the ear, it could either affect the hearing or the balance, or both. So much has to be done to maintain ear and hearing hygiene. What do we mean by this ear and hearing hygiene? These are things, the way we care for the ear, for our hearing, to make sure that this hearing ability is maintained. And one of it is that we should leave our ears alone. We should not put anything inside our ear. The God we serve is very generous. He has made the ear such a way that it is self-cleansing. So we don't need to put anything into the ear to clean the ear. I could call it the carpet that lines the ear, what we call the epithelial lining of the ear. It has a migratory movement such that each time we yawn, we talk, any movement of the mouth encourages that migratory movement. So once it's migrating, it carries the dirt out. So we don't need to clean our ears. And besides, cleaning our ears makes the ear prone to a lot of risk. In the process of cleaning the ear, naturally, there is what we call wax cerumen in the ear. This cerumen helps to trap dirt and things that could have been harmful to the ear. So if you keep cleaning the ear, the message you're telling the brain is that the wax or cerumen in the ear is not enough, that the brain should produce more. So in the process of producing more, it keeps accumulating until it eventually occludes or blocks the ear, such that the individual may not be able to hear very well. Then the cleaning could as well lacerate or cause injury to the canal, which can lead to boils or diffuse otitis externa, which is very painful and could even make some individuals not to be able to take care of their daily activities. Furthermore, the cleaning exercise can rupture or perforate what we call the eardrum, which everybody knows, and medically we call it the tympanic membrane. And this eardrum perforation encourages pus formation within the middle ear. The middle ear is not supposed to communicate with the exterior, but with the rupturing of the eardrum, it now exposes the middle ear to the exterior, such that germs can easily get into the middle ear and form pus. So the individual will start draining pus from the ear. And the worst part of this is that this draining ear, the pus, can enter the brain and cause meningitis or brain abscess. This is because the boundary between the ear and the brain is just by a thin bone called tegmen tympani. And this membrane in some individuals may be dehiscent or absent. Just this bone may just be a membrane which can easily be eaten up by the pus cells, and it enters the brain, forming meningitis, brain abscess, which could be cerebellar or cerebral, and these are all very life threatening, very difficult to train. So the individual may eventually die. At this juncture, I remember a case of a child. When I was doing residency, a 4-year-old girl, the mother kept on cleaning the ears. She did not know that the eardrum ruptured. So the child eventually was draining pus from the ear. She presented this child for treatment, and the child was on daily ear dressing. At a point, the child needed admission, but the parents declined. 3 months after, they brought the child, fitting, having convulsion. We had to tell the mother that the pus cell has entered the brain, and doing a CT scan showed that there was pus accumulation within the brain. The child eventually died. This could have just been prevented just by them not touching the ear, leaving that ear alone to cleanse itself. So a lot needs to be done concerning awareness to people, to change people's mindset concerning ear care and ear hygiene. Other ways we can take care of our ears is by, when we have what we call upper respiratory tract infection, we should treat it well. There is nothing like common catarrh. Catarrh should be treated well. If not, through the back of the throat, where we call the nasopharynx, there is a structure called the eustachian tube. This catarrh could enter the middle ear. The middle ear should be fluid free. Only air stays in the middle ear. But with this catarrh entering the middle ear, its fluid now gets accumulated within the middle ear, and then these children, or if any individual that has it, is down with otitis media with effusion, causing hearing loss. Secondly, when a child has something we call anything inside the ear, what we call foreign body, the children are prone to putting things in their ears. You just have to take the child straight to a specialist who will remove it in skillful way. If it's taken to a chemist, patent medicine dealers, or any other person that is not skillful, the child will come down with perforated eardrum, which could as well cause this chronic suppurative otitis media. And then we should avoid self-medication, drug abuse. There are so many drugs that cause poison, that are poisonous to the ear, what we call ototoxicity. So these drugs are not supposed to be used so that this ear poisoning the hair cells can be prevented. Most individuals are not aware of such drugs. So when they go about using drugs that are not prescribed by specialists, it could damage their ears. And then whenever someone is feeling or hearing some noise, what we call ringing sounds within the ear, what we call tinnitus, the person should present him or herself to the specialist, ENT specialist, for further evaluation and management. So all this, if we can do it, helps to take good care of our ear. Furthermore, amongst our youths, exposure, not only our youth, everybody, exposure to loud sound, loud noise can cause damage to the ear. I know our youth, they like music, boom, 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 that's when they enjoy it, but it gradually damages the ear. It could even be sudden. We have managed and treated pastors, congregation members in the church that after listening or to praises in the church came down the next day with sudden hearing loss. Some of them till today could not be treated because of something that could have been prevented. So we advise, if you know that you have to be exposed to loud noise, from time to time, leave that area, go outside and rest your ears before you come in again. Then, for our mothers, to prevent what we call congenital hearing loss, they should try and book for antenatal care early enough so that the doctors and the specialists will advise them on what they should do to prevent congenital hearing loss, because there are some drugs that even affect children that are in the womb. And not just that, when the children are born, they should make sure that they are fully immunized, because the immunization also helps to prevent hearing loss to some infections which the children would have been exposed to in an environment that could as well cause hearing loss. So a lot needs to be done to prevent hearing loss through proper care of the ear and hearing hygiene.
Well, out of curiosity, are there possible activities or probably lifestyles that could be exhibited by some individuals that could be detrimental to the health of their ear?
Yes.
Besides these ones you mentioned, like music and the rest?
Yes, a lot and a lot. In most families, especially among the couple, when a woman does something that looks stupid, you see the man giving the wife a dirty slap. That slap alone can as well rupture the eardrum, and the woman will come down with hearing loss. Even our children, you see, when they do one or two things that the parents do not like, instead of punishing them, they give them dirty slaps on their ears. You see those children coming down with hearing loss. And besides, most parents term their children stubborn, that they know they hear well, according to our Nigerian Pidgin English. Meanwhile, these children may have had accumulated wax in the ear because the parents are always cleaning their ears with cotton buds or whatever that is available in the environment. And as I said earlier, the cleaning helps to produce more wax, more cerumen, which accumulates and blocks the ear. So once the ear is blocked, the child will not hear, and the parents will be calling the child will not answer them. They will term the child stubborn and heady and stop slapping the child when they call the child and the child doesn't respond. Besides, some children don't do well in school. Once a child is not performing well academically, the child should be evaluated. The ears may be blocked, and simple presenting that child to the hospital, and the child will have what we call ear syringing. Whatever that is blocking the ears will be brought out, and the child will hear well and do well in school. That reminds me of an outreach we did in a secondary school. One female 11-year-old child presented alongside with other students during the outreach, and we saw foreign body in the ear. When we saw the foreign body, we called the parents. Madam, is there anything in your child's ear? Say, no, the child didn't hear well. Oh girl, are you aware there is something in your ear? No. By the time we removed what was in the ear, it was a white big bead. Every other child in the school were like, Auntie, check my ears, check my ear, check my ear. So this child, as a child, maybe in her infancy period, something may have entered the ear and she did not know. You know, children, they play rough play and all that. So presenting herself for screening was what helped us to be able to find out that something was in the ear. So with this, we advise every individual, once there is a screening exercise going on anywhere, please present yourself. Don't say I can hear, I don't have any problem. Just like this child now, if not that she presented herself, we wouldn't have been able to help her. And when we brought it out, the child was like, everywhere is too loud. We told her everywhere is not loud. You have not been hearing well before. It's now that you're hearing well. That's why it seems as if everywhere is loud. Thank you.
You actually made a very intriguing point as to more like the act of staying away from touching our ears. More like, it's really intriguing because it's more like Nigerians are always used to, touching the ear, using cotton bud to, clean out the ear. Some person might actually tend to, go further to say the use of cotton bud is actually wrong. Maybe some other objects just fetch out the wax. But I never knew that was actually important, So it's really intriguing to know we are not actually supposed to really tamper with the ear.
Yes.
All right. You made mention of ringing sound, and in terms, was it tinnitus you used?
Yes, tinnitus.
What exactly is that, and how would someone start experiencing ringing sound? And
yes, ringing sound most times comes from the middle ear, pathology, and sometimes pathology within the inner ear. Most times when an individual has fluid within the middle ear, which we call otitis media with effusion.
I do you mind breaking it down?
Okay, fluid within the ear. As I said earlier, that when an individual has catarrh, which we call common catarrh, common cold, that it could enter the middle ear through the back of the throat or back of the nose. This fluid that enters the middle ear can be given, when you walk, you could hear some bubble sound. That sound, that abnormal sound you're hearing in the ear is called tinnitus. It could as well come from blockage of the eustachian tube itself, which we call eustachian tube dysfunction. This eustachian tube, it's a tube that connects the middle ear to the exterior. It helps to equalize pressure within the middle ear and the exterior, and it also helps in ventilating the middle ear, as well as helping in the drainage of fluid from the middle ear to the exterior. As I said earlier, there is not supposed to be any fluid within the ear, only air exists within the middle ear. So that is most times what causes tinnitus in the ear. Secondly, there are some drugs, as I said earlier, that when you take them, you start feeling some sound within the ear, showing that that drug is ototoxic. Some drugs like gentamicin, chloramphenicol, aspirin, most drugs that people abuse, they cause problem in the ear, and the first sign they give is that ringing sign in the ear.
Okay, I'm really tempted at this point to talk about political with Prof, but just before we go to Prof, let's talk about, is there need for periodic ear checkups, and is there really a period attached?
Yes, for individuals that already know that they are prone to hearing loss, they should visit the specialist more often. Then establishments, industries, from time to time should allow their staff to go for interval hearing evaluations. From most studies we have had, we have also seen that it is very necessary for any newly employed individual to first of all have a baseline hearing assessment and then go for periodic hearing evaluation, such that with the baseline and then whatever is happening within the interval examination, you could be able to detect that this individual that had a good hearing before now has a mild hearing loss, should be presented for further management. Not just that, every other individual, in fact, establishments should have it as a policy that all staff should go for periodic hearing examination, especially those of them that are exposed to occupational noise, occupational hazard, so that from time to time it could be detected on time. And they too should be given what we call ear muffs or ear plugs to protect their hearing and protect their ear from hearing loss.
Indeed, I really hope the establishment actually look towards this direction. Now, Prof, we're talking about political will of the government. Is it more like the government has no interest in, should I use the word, small situations as these, but rather, focus on what they rather regard more important challenges? Or is it more like investment generally? We are an institution where we don't exactly have funds for just everything and anything per se. So what exactly do you think is more like mitigating factor as to the government already having that political will you quoted?
Yeah, thank you very much. Let me cite a case in 1995 when Professor Itayo was the Federal Minister of Health. Neonatal hearing screening program was instituted in this country. But no sooner he left office, nothing was done again. When President Jonathan was the president, there was an initiative by the Federal Ministry of Health to screen about 5 or 10 million Nigerian children. But I think that policy went away with him, because I haven't seen that. I'm yet to observe that children in secondary school or primary school are being screened. Is a policy, is on paper, but implementation is our problem. It cuts across different strata of the society, implementation. But when we make a policy, I think we need to implement it. Nigeria is one of those countries that do not have what we call neonatal hearing screening program. There are two types: targeted screening and blanket or universal screening. When a baby is born elsewhere, particularly in the developed world, before the baby is discharged from the hospital, every sensory organ is subject to examination, including the auditory. They check the ears, they check the eyes, they make sure everything is fine before the child is discharged. The targeted one, if we cannot afford the universal one, that every baby must be checked, we can target those people, those children who have some congenital issues. For example, a baby born with jaundice, kernicterus, and had to undergo what you call exchange blood transfusion. I have seen some children, they come to the clinic when they are 4 or 5 years old, whereas these children would have been detected so early, as soon as they were born, when the exchange blood transfusion was done. Or you see children with meningitis, with measles, with craniofacial abnormalities, all kinds of syndromes. They are prone to hearing problems, hearing loss. So we need to fine-tune our policy and make sure that implementation is carried out, irrespective of which government is in power. And we need more specialists. We need manpower. In this country, I would say, perhaps in audiology, where I'm specialized, perhaps Western trained audiologists in Nigeria are less than 10. Some have jackpot, as we always say, So we need manpower. We need to be able to hold the bull by the horn by confronting this issue, because we don't know what is going to be in the year 5 years away from now or 10 years away from now. We now have 8.5 million. In fact, I even dispute that 8.5. Why do I dispute it? We go to the pharmacy, we buy medications, nobody prescribes the medication, and like Dr. Akpalaba has rightly stated, we have what we call ototoxic medications. Not only ototoxic, vestibulotoxic, which can even cause balance problems. They dish it out on the counter, which is wrong. I've spoken about noise pollution all over the place. I think Lagos State is getting it a little bit better. They have a policy now called Noiseless Lagos, of which some of us are part of. And there's a law against noise pollution, and they prosecute people. So people are now more conscious and become more aware and more careful about it. So we need to make sure that we implement our policies, we implement our laws, and of course, I'm not saying all resources should be channeled to one place, but for goodness sake, we just heard about a case of a child who could not hear, and because of that, he was knocked down by a car. Yes, over here, we struggle with Okada on the road, we struggle with cars on the road, we struggle. In the advanced countries, they have pedestrian pathways where you don't have any contact with an oncoming vehicle. So we should look into all these things and make sure that our society is people friendly, and of course we need to protect those who have already suffered from hearing. Let me give you an example. Hearing aids are given out in Western world. We have NHS in the UK, we have Medicare and Medicaid in the US, and so on. But in Nigeria, hearing aids cost about $1 million. How many people can afford that? Why can't the government look at, okay, for 0 to 10 or 0 to 15, we give you free hearing aids? Or the elderly people, the aged people who have worked all their life, they do not have any form of assistance. If they want to buy hearing aid, as we age, we tend to lose our hearing. And that's why it's very important for us to check from time to time, because we always feel that, oh, well, I don't have any problem with hearing, but something is happening discreetly, and we need to find out what it is before it becomes too late. So let's look at children. It could be 0 to 10 years old. Aged people, it could be people from 60, senior citizens, to 70 and 80 and on and above. We could provide services to them free of charge. We could provide them with hearing aids so that they can have a quality life, you know. So these are some of the things. I'm not saying government is not doing its bit. They are doing their bit, but they need to do more, like it has rightly been said. So this is my opinion. Thank you.
Concerning the campaign so far about the ear care in Nigeria and Africa at large, how far has it gone, and what is probably the projections and targets for the next 5 to 10 years?
Yeah, thank you so much. I would say the campaign is sinking in gradually. It is very gradual. People are beginning to be aware of certain things that will actually cause a damage to the auditory system. We've spoken about cotton board. Now, a few number of people are aware that leave your ear alone. You do not need to touch the ear. So that information is resonating, and people are complying with it. Not everybody, but certainly it's a gradual process. And like yesterday, we brought in secondary school students. They had debate, they had quiz. I'm sure they will go back and tell their parents, no, don't do that. Why are you putting a key in your ears? Why are you putting a biro, the tip of a biro? No. We've been told not to. You know, the message is going on, it's resonating. It's a gradual process to change the mindset of the people. It's not an instant thing. And I think in the next 5-10 years, I believe that we'll be able to get to a peak where people will be very, very aware, and they will do the right thing regarding auditory care, hearing care. Yes. All right.
Just before we leave, because we're actually out of time, in a minute, I would like you to give your last words to the public on how to take care of their ears, for both of you. Okay.
All right. Both of us. Okay. We need to be conscious of what we do. Even there's a research of which I participated, where we found out that people who smoke cigarettes are at a risk of having a hearing problem. Yes, nicotine is ototoxic. People who abuse alcohol they stand a risk of losing their hearing. People who buy medications at random without actually going to a doctor to prescribe medications, they are at a risk. People who expose themselves to excessive noise without caring for, let us do constant check, periodic check, whether this noise is having an impact on me or not. Some people always say, we are used to it. I wonder why somebody will say they are used to something that is injurious to their health. You know, noise does not cause only auditory problem. It causes cardiovascular problem. It releases stress hormones, which result into aggression. If you have been to Lagos before, I'm sure most of you know downfall drivers and downfall conductors, how they behave. You know, sometimes you begin to wonder, are these people, are they normal human beings? You know, because they are exposed to deleterious noise, excessive noise. And at the end of the day, they begin to misbehave, they begin to behave abnormally. You know, so all these things, we need to be aware of them and insulate ourselves from all those things that could actually injure our auditory system. I yield to Dr. Akpalaba.
Yes, thank you. Yes. So I advise everyone, let us change our mindset concerning hearing loss. Let's stop stigmatizing those that already have hearing loss. Because from interactions and discussions, I've also gotten to know that some individuals that have hearing loss, people tend to take it that is punishment for the sins of their parents or their forefathers. Parents. So people should change that mindset. If you see someone in the community that has hearing loss, and you know of someone that can take care of it, please refer the child or the individual to the appropriate quarter for specialists to take care of them. And then we should all leave our ears alone. Avoid loud sound. Avoid also using pointed objects. In fact, this reminds me of a child, a girl that was making her hair with pointed comb. The comb they use in cutting the hair. So as she was doing the hair outside, there was storm and thunder. So she ran to go and carry her clothes outside. Carry the clothes. Coming in, the door now slammed and pushed the tip of the comb inside the ear. The eardrum perforated. The girl started having discharging ear. This could have been avoided if she had simply kept the comb and then run to go and pack her clothes. So we should all change our mindsets concerning so many things. We should keep away from pointed and sharp objects. Don't put anything in your ears. Leave your ears alone. And parents, stop slapping your children on the ears. Husbands, stop slapping your wives. With this, we could all change our mindset and make ear and hearing hygiene and care a reality for everybody. Thank you
so much for joining us on this episode of Daybreak Africa. We hope to have you again next time.
Thank you so much.
For me, it was more like a free consultancy session for free.
Anyway,
thank you so much.
Thank you to our audience as well for tuning in to Daybreak Africa. And you've heard it all from the professionals. Do take care of your ear. I mean, aside all part of your body which we preach every day, I think the ear is also a very sensitive part of your body you should pay attention to. And just like you've heard it all, I do not need to repeat myself. There is an importance why you should take care of your ear. I mean, if you lose it, that's the end of it, so you're not going to get it any longer. So thank you once again for joining us on this episode of Daybreak Africa, and this is where we're drawing the curtain for today. Until we come your way again, I am Angela Daku.
You do have a wonderful day. I remain Ezekiel. Okay.